think we are set. Good afternoon, and thank you again for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are joining us again virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Jim Kenney.
Thanks, Mike, and good afternoon, everyone. As many of you know, Governor Wolf has said that effective Friday, construction business in Pennsylvania can resume. We are currently reviewing that order with respect to construction work in Philadelphia, and we'll have more details tomorrow on the extent to which work can return to the city. But for now, I can tell you that with some limited exceptions, construction projects that were subject to the state shutdown order on March 20th will be allowed to resume on this Friday in Philadelphia on this Friday. Construction managers and workers will have to consistently follow practices, keep their workers and the community safe. I'm confident that this will prove to be a much needed boost to economic activity in the city. And I'm equally confident that everyone involved will be vigilant about adhering to these safe procedures and protocols as this work resumes. Again, we'll have more details tomorrow on how this work will resume in Philadelphia. As we continue to stay home, wear masks and disinfect our homes to stop the spread, I want to take a moment to remind residents to please dispose of masks, gloves, and wipes properly. We are seeing a large increase in the amount of personal protective equipment being discarded through people flushing those items down their toilet. This is taking a toll on our water treatment infrastructure and residents' own private property. So far, 19 of the Philadelphia Water Department's pumping stations have been impacted by PPE waste, including gloves, masks, and most of all, wipes. The Water Department is seeing 12 times more infrastructure clogging waste at facilities than normal. They are now reporting 100 pounds a month versus the usual 100 pounds a year. The sudden influx threatens not only our waterways and the various species living in them, but it directly contributes to a notable increase in the likelihood of water main breaks. As many of you know, water main breaks interrupt critical water pressure and availability and cause notable damage to residents' homes and property. We want to ask everyone to please be mindful to dispose of masks, gloves, and wipes properly. These items should go into a wastebasket. They should not be left on the ground, and they should not be dropped into a sewer inlet. And most of all, they should not be flushed down toilets. We also want to drive this point home. Flushable wipes are not flushable, despite the label, and should not be flushed down the toilet. Instead, throw your wipes out in your trash can. This also includes any cleaning or antibacterial wipes. We understand that these critical items are needed to protect us as we continue to face the impacts of this pandemic. However, without proper disposal of these items, we could create major public health and public infrastructure hazards that could impact us long after this pandemic is over. Please do not flush any of these items down the toilet. That was an odd conversation, but we had to have it. Since we are on the topic of the Water Department, I also want to take this time to remind residents that the Philadelphia Water Department and the Water Revenue Bureau have postponed all water shutoffs for residential and commercial customers who are unable to pay their bills through June 1st, 2020. That's June 1st, 2020. This is a 16-day extension of the original postponement period, which prevented delinquent accounts from being shut off through May 15th. The date is now June 1st. It is still important to pay your bill if you can, since the Water Department's operations are funded by revenue from the water bills. While we are not shutting people's water off, customers will still receive a bill that balance will continue to accumulate as water services are used. Customers who cannot pay their bill should apply for help by using the application at phila.gov/water bill help. That's phila.gov/water bill help. Now, before I turn it over to Dr. Farley, I want to acknowledge another unfortunate milestone in our battle against COVID-19. With today's newly reported deaths, more than 500 Philadelphians have perished due to the virus. That's 500 of our neighbors and residents of the city have passed away due to this virus. Our thoughts and prayers are with all their loved ones. Please know that all Philadelphia joins you in mourning these individuals, and we'd like to send our prayers, special prayers for them. So with that, Dr. Farley, please, your update.
Good afternoon. The situation with the epidemic is about the same today as it was yesterday. We have 577 new cases that were reported in Philadelphia residents, bringing us to a total of 13,445 since the beginning of the epidemic. Now, much of this is cases that were previously reported but have now been identified as Philadelphia residents. Yesterday I said that it looked like we were past the peak of this epidemic. And it still looking like we were past the peak, but the decline we're seeing in daily cases is a very slow decline. It's not as fast as we would all like it to be. If you want to get the overall sense of that, just look at the website. We have a graph there that you can see to follow the overall trends. We're continuing to address clusters of this infection in congregate settings where people live together, including nursing homes, behavioral health facilities, and the city's jail. The jail cluster now has currently 71 inmates who are testing positive. That includes 8 new positives from yesterday and 5 others who recovered from yesterday. We have 32 new deaths from the coronavirus infection reported since yesterday, bringing us to a total of 516 deaths since the beginning of the epidemic. Now, there have been and always are delays in identification and reporting of those deaths. And some of those deaths occurred up to 2 weeks ago. So again, with the situation with cases, look at the graph on our website and you get an overall sense of trends in deaths. Of those 516 deaths we've had so far, 288 or 56% have been in nursing home residents. So this epidemic continues to hit nursing home residents particularly hard. Our situation in hospitals is about the same. This morning we have 1,001 people with the coronavirus infection in Philadelphia hospitals and 1,856 in hospitals in the entire Philadelphia metropolitan region. Those are an increase from the numbers we had yesterday, about where we were a couple of days ago. We've had a couple of days of decrease and increased a little bit in the last day. Our testing is available, and we're gradually increasing the access to testing, and we're gradually increasing the number of tests that we do. For people who want more information about where to get tested, all the details on our website. Just go to www.phila.gov/COVID or /COVID-19. You can see links and phone numbers to all the sites, and we're going to continue to be adding sites to there where you can get tested. Just to sum up, for people in general, we're still seeing many cases of this infection. Many people around you have this infection. You should assume that anybody you come in contact with has the virus. You should even assume that you have the virus. So that's why just stay away from other people. If you have to go out of the home, wear a mask so you don't spread that infection or you don't acquire that infection. Lots more information about this at www.phila.gov/COVID, or for medical questions, 800-722-7112. Thanks.
Thank you, Dr. Farley. And now Armando will provide the Spanish language translations of both Mayor Kenny's and Dr. Farley's comments.
Mensaje del alcalde Jim Kenney para el martes 28 de abril del 2020. Buenas tardes a todos. Como muchos de ustedes saben, el gobernador Wolf ha dicho que a partir del viernes las actividades de construcción en Filadelfia pueden reanudarse. Actualmente estamos revisando esa orden con respecto a las obras en construcción en la ciudad y mañana les daremos más detalles respecto a cuándo pueden reanudarse estas actividades en Filadelfia. Puedo anunciar por ahora que con algunas excepciones limitadas, las obras en construcción que estaban sujetas a la orden del 20 de marzo se podrán reanudar este viernes en Filadelfia. Los ingenieros y trabajadores de la construcción deberán observar las mejores prácticas para mantener seguros a sus trabajadores y a la comunidad en general. Estoy seguro de que esto le dará un impulso muy necesario a la actividad económica en la ciudad. Y estoy igualmente seguro de que todos los que construyen la ciudad estarán atentos para cumplir con estas pautas a medida que se reanuden las obras en construcción. Mañana les tendremos más detalles sobre cómo se reanudarán estas actividades en Filadelfia. Mientras tanto, tenemos que seguir respetando la orden de permanecer en casa, seguir usando máscaras al salir y desinfectar nuestras casas para detener la propagación del virus. También quiero recordarles a los residentes que por favor se deshagan correctamente de las máscaras, guantes y toallitas después de usarlas. Estamos viendo un gran aumento en la cantidad de equipo de protección personal que se está desechando en los inodoros. Esto está afectando nuestra infraestructura de tratamiento de agua y la propiedad privada de los residentes. Hasta ahora, 19 de las estaciones de bombeo del Departamento de Agua de Filadelfia se han visto afectadas por residuos de equipo de protección personal, incluidos guantes, máscaras y, sobre todo, toallitas. El Departamento de Agua reportó 100 libras en desechos al mes en comparación con las 100 libras al año que se reportaba normalmente. Esta gran cantidad repentina de desechos amenaza no solo nuestras vías fluviales y las especies que viven en ellas, sino que contribuye directamente a un aumento notable en la probabilidad de rupturas de las principales tuberías de agua. Queremos pedirles a todos que estén atentos y se deshagan adecuadamente de las máscaras, guantes y toallitas. Estos artículos deben ir a los basureros, no deben dejarse en el suelo, no deben botarse en las entradas del alcantarillado y sobre todo no deben arrojarse a los inodoros. También quisiera aclarar que las toallitas que se pueden tirar al inodoro, de acuerdo a la información que aparece en su empaque, no deben ser desechadas allí. Les repito, no se debe tirar en el inodoro. En su lugar, tire esas toallitas a la basura, por favor. Esto también incluye cualquier artículo de limpieza, como algodones o toallitas antibacteriales. Debido a que estamos hablando del Departamento del Agua, también quiero recordarles a los residentes que el Departamento de Agua de Filadelfia ha pospuesto todos los cortes de agua para clientes residenciales y comerciales que no puedan pagar sus facturas hasta el 1 de junio del 2020. Esta es una extensión de 16 días del periodo de aplazamiento original que evita que las cuentas morosas se cierren el 15 de mayo. Si es posible, por favor, pague su factura, ya que las operaciones del Departamento de Agua se financian con los ingresos de la facturación. Y si bien las personas y comercios no sufrirán un corte del servicio, los clientes seguirán recibiendo una factura y ese saldo continuará acumulándose a medida que se utilicen los servicios del agua. Los clientes que no pueden pagar su factura deben solicitar ayuda en philadelphia.gov/water bill help. Para finalizar, quiero reconocer otro hito desafortunado en nuestra batalla contra el COVID-19. Con las muertes que vamos a reportar hoy, más de 500 habitantes de Filadelfia han muerto debido al virus. Ellos y sus seres queridos están en mis pensamientos y en los de todos los residentes de Filadelfia. Y esta es la actualización en materia de salud al martes 28 de abril del 2020. Desde ayer se han confirmado 577 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 13.445 casos en la ciudad. Muchos de estos casos no habían sido identificados como pertenecientes a Filadelfia. Aún así, estudiando los datos de Filadelfia y los datos de la región, parece que hemos pasado el pico, pero el descenso es muy lento. Las tendencias pueden ser revisadas en el sitio web fila.gov/COVID-19. Tenemos 8 casos positivos de COVID-19 entre los internos, con un total de 71 casos registrados y 5 internos adicionales que se han recuperado satisfactoriamente. Tristemente, reportamos 32 nuevos fallecimientos en Filadelfia. Hay un total de 516 personas que han muerto por la COVID-19. 288, o el 56% de ellas, han sido en hogares de ancianos. Este virus no discrimina por raza o por género. 1,001 personas han sido hospitalizadas en Filadelfia, 1,856 personas en la región sureste de Pensilvania, y se ha producido un aumento en el número de pacientes hospitalizados después de 3 días de disminución. El 29% de las camas de los hospitales y el 28% de las unidades de cuidado intensivo todavía están disponibles en nuestra región. Y continúa la limitación en el número de pruebas disponibles debido a la escasez de hisopos para poder recolectar las muestras y a la capacidad limitada de los laboratorios. Se recomienda que las pruebas se les den a las personas mayores de 50 años que presentan síntomas. Usted puede encontrar mayor información sobre los centros de pruebas visitando fila.gov/COVID-19 bajo la pestaña FAQ. Y todavía hay muchos casos, hay muchas personas infectadas y muchas personas que no lo saben porque aún no presentan síntomas. Hay que asumir que todo el mundo a nuestro alrededor tiene el virus, incluyéndonos a nosotros mismos. Uno no quiere transmitir la infección a su familia, a sus amigos, a sus vecinos y a la gente que circula por las calles. Si tienes el virus y eres joven, puedes recuperarte, pero para otros ese virus puede ser fatal. Por favor, mantén la distancia social y quédate en casa. Si usted debe salir a trabajar o al supermercado, te recomendamos mantener la distancia social de 6 pies, usar máscaras de tela en lugares públicos donde sea difícil mantener la medida de distanciamiento social, lavarse las manos apenas llegue a casa y para mayor información puede consultar el sitio web www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas, los 7 días por semana al 1-800-722-7112. Esta llamada es gratuita. Gracias.
Thank you, Armando. We're now going to move to the Q&A portion for members of the media. And again, we would like to ask our speakers today to join us with their audio and video on. And please remember, we have limited time during the briefing. So as usual, only one representative from each media outlet is permitted for the first round. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. First up today is Annie McCormick of 6 ABC. Annie, you're up.
Hi, can you hear me?
Yep, go ahead.
Okay, I have a quick question for you in regards to golf courses. We're checking out a number of the city courses. Just to let you know, my mask is down, but I'm a safe distance away from people. They're telling us right now on the website that they haven't gotten the okay from the city yet to begin taking tee times, as opposed to other townships in Pennsylvania with their public courses where they have been able to. Do you have an idea if golfers will be able to hit the public courses in Philly on Friday?
Mayor, do you want me to handle that, or do you want to take
Yeah, please.
So we're currently under consideration on exactly what our posture will be with golf courses. We should be able to give you an update tomorrow, but we're currently reviewing that.
So at this point, people can't even book tee times for Friday?
At this point, because we haven't made a decision about the whether golf courses can open on Friday. So we're asking folks to stand down until we can make a final decision.
Okay, thank you. That's all I have.
Great, thank you, Annie. Next up, Laura McChrystal of the Inquirer.
Hi. First of all, a couple of questions about infections in the jail. Montgomery County announced yesterday that they had done mass testing in their jail. I'm wondering if the city has considered or has plans to do anything like that, either in the jails or in other congregate settings.
I can start, and then Dr. Farley, if you want to move forward to wrap up. I think given the availability of testing, yes, we have considered it. The availability of testing has limited our ability to do mass testing in our jail. We certainly understand people's desire to do that. We just don't have the available tests at this point, and certainly not in all the congregate care facilities across the city.
So in all the congregate care facilities where we have an outbreak and we're involved with the folks there, we are testing people who have symptoms, and we're testing some people who don't have symptoms who have been exposed we're concerned about. We have not gone to testing everybody who doesn't have symptoms because of the availability of testing, and because it isn't clear that testing all the other people who don't have symptoms really would have a real benefit. So right now we're trying to sort of, do the testing that makes the clearest sense for infection control.
And I just do want to add one other thing, especially as it relates to our jail. We are making the assumption and treating the jail population as if everyone is positive for COVID-19, and that's why we've taken such significant steps around masking of all inmates, of limiting movement, of providing meals and medicine in cells, is to that end to try and limit the spread of the disease.
Okay. And in the jails, is testing only happening for those who are showing symptoms, or are you also testing people who might have been exposed to someone who had it?
So there is some testing of inmates who don't have symptoms, who, depending on their proximity to other people who have the infection.
Okay. And would you be able to give us the infection rate, or the percentage of tests that are coming back positive out of the prisons?
I don't know the answer to that. We may be able to. Let me look into it and get back to you.
Thanks.
All right. Thank you, Laura. Pat Loeb of KYW, you're up next.
To follow up on Laura's question, the numbers in Montgomery County were quite astounding. 170 of about 800 tests that came back were people with no symptoms who tested positive. Does that raise any concerns with you about false positives being possible, or have you looked at these results? Dr. Farley, do you?
I haven't seen these results. Our feeling has been that the number of false positives is pretty low. You can never be sure. These are all new tests. We do know, though, that people can have this infection and have no symptoms. So it may be that that's a fair number of people who have the infection have no symptoms. With any testing, just to get back to what I said a couple of days ago, you have to think, what is the value of the information? And so if you're taking steps to avoid transmission from one inmate to another, I'm not sure that knowing that someone has an infection, if they have no symptoms, is of huge value. So it doesn't necessarily mean we need to test everybody. I would start with the assumption, getting back to your question, start with the assumption that the test result is real. But that still raises another question about what's the best way to control the infection in the facility.
Thank you. And for Brian, are masks being required at businesses that operate inside the Philadelphia International Airport?
I don't believe they're required, but they're urged. And so I do want to take a minute to kind of talk through that. So on April 15th, the Secretary of Health of Pennsylvania issued an order requiring that all life-sustaining businesses follow several preventive protocols, among them wearing masks of employees and customers. The City of Philadelphia's Division of Aviation owns and operates both Philadelphia Airport and Northeast Philadelphia Northeast, and both were deemed exempt from that order. And so on April 17th, Shelley Cameron, our CEO, urged airport tenants, including airlines and concession vendors, to implement the state's recommended guidelines and measures where practical. And the majority of the airport's operational tenants and employees are already in compliance with these measures. Unfortunately, there's currently no PHL specific requirement for passengers to wear face masks, as that effort would have to be coordinated with PHL's airline partners, security personnel, and concessions vendors. And clearly, some federal guidance on that would be incredibly helpful, given federal regulations over airports as well. And so we are certainly considering additional safety measures, and we'll continue to support all of our stakeholders as we want to keep all of our employees and our customers safe.
Okay, and a follow-up, when you say they were deemed exempt by who? Because the state health department says the order didn't apply to municipal governments, but it did apply to businesses operating within the city. So why would it not apply to private businesses operating within the airport?
So from my understanding, the Department of Health issued guidelines that Pennsylvania airports are exempt from the order because the FAA regulates airports.
Okay, thank you.
Yep.
Very good. Thank you, Pat. Next up is Max Marin of Billy Penn.
Hi, everybody. Thanks for your time. Laura and Pat covered most of my questions about the Department of Prisons. Just have one question then for Brian. Yesterday, it was mentioned that the city was changing its admission policies for the quarantine locations. I just wanted to know if those measures went into effect today and if there's anything new to add there.
So they are in process of going into effect. They'll actually probably be fully in effect tomorrow. So you'll start to see the census increase in our numbers on Thursday. But they are not in full effect today.
Okay, thanks, Brian. That's all.
Thank you, Max. Natasha Brown of CBS 3, you're up next.
Hi, thank you very much. Good afternoon, everyone. This question is for Dr. Farley. Dr. Farley, if you could talk to us a little bit about some of the expanded testing sites, especially the ones that you're putting in some of the underserved areas. Can you talk a little bit more about, whether they're up and running right now and what you're seeing at this point, or when you expect them to be fully operational?
So most of these sites are in federally qualified health centers. These are health centers that serve underserved populations, people who maybe on Medicaid, people may not have health insurance at all, and they're used to dealing with that population. And many of these sites have had testing before for their own patients, but what they're doing is expanding access to people who may not have been their patients in the past. The sites are going to be coming sort of online gradually, day by day. Some of the information is on our website as to which ones are operational today, which ones maybe tomorrow. They're not going to necessarily be 5 days a week. Some of them maybe only 3 days a week, but you'll see more and more of them available in the next week or two.
Okay, and one last question for you. Just in reference to the number of positive cases today, new cases, 577. I think yesterday was a little over 300, but you still believe that we're on the downside of this peak at this point. Tell me how that works, and how are you seeing that that's still the case?
Yeah, so our data comes in batches, and in particular, over the weekend, we don't get full reporting. And so that's why you might see these large differences from one day to the next. The best thing to look is something like the 7-day average. And if you look at that, it looks like we may have hit a peak around April 10th or April 12th, April 8th maybe, and we're down since then. It's not down very much, so maybe an average of a little above 500. Now maybe we're in the 450 range, and so we'll continue to follow that. But I would suggest you look at the overall graph and the moving average rather than any individual days count.
Okay, thank you very much.
Thank you, Natasha. Martin Pratt of Philly YB, and you're up next.
Hi, thank you. I have 3 questions. The first question is for the Wi-Fi for the kids' laptops or Chromebooks. Has that situation moved towards some type of resolution as far as you know?
As far as I know, we're close, but let us follow up with you later this afternoon.
I talked to some high school students and they're unclear about, there was a call that I believe was made yesterday to most students that they would receive some type of instruction on how to move forward in their classwork. And it's been confusing for most of the students on navigating Google Classrooms and being able to turn in assignments. So are you aware of that? And has there been any discussion about, maybe providing them some type of mentorship or some type of teacher's aid, let's say? Have you heard anything about that, or are you aware of that?
I haven't heard anything about the high school students and that confusion, but we're not directing them out of the managing director's office or the mayor's office. So we'd have to find out if they have any anecdotal information about complaints and confusion, and we'll try to address it and hopefully have an answer for you tomorrow.
Okay, thank you.
And Martin, I would also encourage you to address the school district directly.
Okay.
That's exactly who I'm going to go to. So
Gotcha. Sure. And then, we're really concerned. We've been really blessed to not have some of the same issues that New Jersey has and other surrounding states. Is there any discussion about, once the other states start to reopen, travel into Philadelphia airport? If someone comes from a different state, are they going to be required to like we did with New Yorkers, self-quarantine?
So, I think in general, travel restrictions don't make a big difference in the epidemic. And it looks like the country is following things in parallel. So I can't say for sure. In general, there's not a lot of travel taking place right now. If there were very high rates somewhere else and very low rates here, then I would think about that. But my guess is we're not going to be in that situation.
Okay, that was it. Thank you.
All right. Thank you, Martin. Argenis Figueroa of Univision, you're up next.
Hello, good afternoon. Thank you, Mayor. I will ask in Spanish, please. Yo quisiera saber, entendiendo que la comunidad latina indocumentada de la ciudad es una de las más afectadas en esta crisis, si desde la alcaldía han pensado abrir nuevos sitios de entrega de alimentos, y si me puede decir cuál es la razón por la cual el distrito escolar cambió a solamente un día a la semana la entrega de estos alimentos.
My question has to deal with the undocumented population in the city that's been affected by this crisis. And I would like to know if there's any thinking of opening new sites for distribution of foodstuffs and why the school district has reduced it to 1 time a week.
Well, we have a lot of food distribution locations in practically every neighborhood or in many schools throughout the city. We're not asking for identification. We're not asking for proof of citizenship. We're just serving people who come to the site. So I don't know, other than that, what else we could be doing to reach people more. Some are experiencing some food issues, and we're continue to accumulate the food we need to feed people and to get food into people's hands. I'm not sure about the district, Brian, unless you know why.
I can, yeah. So the school district decreased distribution days for efficiency. but the same amount of food is still being distributed every day, for every. So we haven't decreased the number of meals, just the number of times that those meals are distributed.
La respuesta, Argenis, tiene que ver con que hay mucha comida disponible en muchos sitios de distribución a lo largo de la ciudad. En las escuelas donde se está entregando estos alimentos no se pide identificación ni se pide prueba de ciudadanía. Estamos tratando de servir a la gente y hay comida acumulada para su distribución. Sencillamente no sabemos cómo comunicárselo mejor a la gente, que es algo que pudieran hacer ustedes. Los distritos escolares efectivamente redujeron los días en los cuales se distribuye la comida por propósitos de eficacia, pero se está distribuyendo la misma cantidad de comida, aunque haya disminuido la frecuencia.
Ok, muchas gracias, es todo. Thank you.
Thank you very much.
Mike Dunn, you're muted.
Sorry about that. Gerald Murphy of WHYY, you're up next.
How you doing? This question is for the mayor. I was just curious to know, where are things with talks between the city, SEPTA, and the workers union?
That's been resolved. It was resolved Saturday or Sunday, wasn't it?
I actually thought it was resolved Friday, but yeah,
Friday.
It was resolved certainly over the weekend.
Okay, thank you.
Was that it, Daryl? You're good?
Yep.
Okay, very good. Kennedy Rose of the Philadelphia Business Journal, you're up next.
Hi, everybody. This is for either the mayor or Brian. I was wondering, what sort of demand have you seen for the $10 million Paycheck Protection Program initiative that you have with Goldman Sachs and Lendistry?
I'm not aware of those specific numbers. I don't know if you.
I don't have the specific numbers, but I know the demand is high. We can certainly connect you with the Commerce Department, who's tracking that more directly. But absolutely, the demand was high, just as it was for the first round. And just like the first round, there was also glitches in the application process. But I think Sylvie or the Commerce Department is going to be better equipped to answer the question directly.
Alrighty, fantastic. That's all I had. Thanks so much.
And Kennedy, if you shoot us an email to press@phila.gov, we'll try to get back to you with more specifics on that. Brian McCrone of NBC 10, you're up.
Hi, hello there. Just want to follow up because I didn't get a chance to ask you yesterday, and I wanted to ask, coming as the budget issues and coming up on Friday, can you? I know you don't want to get. I know you've been avoiding getting into specifics about what you might cut, but I was curious on the maybe the more optimistic, positive outlook side to it. Is there anything that you, the mayor, and your cabinet have been talking about? Kicking around ideas about what you can do that coming out of the crisis that can actually enhance the city's services and creative wise. Don't let this crisis go to waste in terms of thinking proactively, maybe technology, something along any of the lines that you might think you might actually be able to take advantage of.
We've been having those discussions and wide-ranging discussions about the budget in the future, and we'll have something for you on Friday.
Anything else, Brian?
No.
Okay, very good. Thank you. And Max Marin will actually, let's go to Max Marin and Billy Penn. There you go.
Just one more follow-up question for Brian about those quarantine sites I'd asked about. I just wanted to clarify, will released inmates from the Department of Prisons be included in that criteria or not?
Yes, in some cases. So I think I need to follow up on exactly where we are on that criteria, yes. But for folks who have nonviolent offenses and have nowhere else to go, the quarantine site would be available to them.
All right, thanks, Brian. That's all, Mike.
Thank you, Max. Jason Peters of Philly Weekly, you're up.
Hello, I just wanted to ask, has the current pandemic situation led you to consider any larger structural change to city infrastructure, things like healthcare?
Healthcare for employees?
Just the general healthcare system in general, things like, I guess, Medicare for all, or considering larger structural changes in the midst of what the pandemic has done to the city and general country.
On a city basis or national basis?
national basis or city basis, general infrastructure.
We've seen clearly that people not having medical insurance or coverage has exacerbated our situation in the United States and has helped move the situation along in other countries that have health coverage for everyone. Countries like Germany, have a great health system. It's paid for by the government. I know people want to avoid that, push it back, call it socialism, call it communism, whatever. But you see what happens to a nation that has the wherewithal to take care of everyone's health needs and doesn't do it. You can see how multiplied the pandemic, how multiplied the misery is, because people in Washington don't want to talk about health care for all their citizens, all the people who live here. Hindsight's 20/20, and I hope they can see in the rearview mirror that they made a mistake by not doing it.
Okay, and then last questions for, I guess, Dr. Farley. Have you considered any alternative methods of testing? I saw a report by Al Jazeera citing that Senegal and England has repurposed some dengue fever type tests, and they're using that to test people. Have you guys considered anything like that?
I don't know what kind of tests you're talking about. The tests fall in a few categories. There's the test that measures the virus itself. That's using a technology called PCR. That's the bulk of what we're doing right now. There are other tests which measure the antibodies to the virus. And those we're not recommending right now in general. It's really unclear how to interpret those, and they're not necessarily useful for an individual person. So the PCR test is still what we're going to be using and what's available to us.
Okay, thank you. That's all from me.
Thank you, Jason. Let's go back to Pat Loeb of KYW.
Thank you. Apparently people are gathering at the Art Museum to watch the Blue Angel flyover. And I just wondered, in light of the mayor's comments yesterday, if anyone has any comment today about whether they should be doing that, whether that gathering should be broken up.
Well, first of all, they apparently didn't listen to me, hoping that they're all wearing masks and standing 6 feet apart. And people have to stop being selfish and self-centered. I saw a picture on social media today of a bunch of young people playing volleyball in Franklin Square, not distancing themselves and not wearing masks. Unlike totalitarian China, I don't think we should be using the police to be carting people off to jail because they're not following that. We continue to try to express to them what's right to do, and they should be doing it. I don't know if we really, I appreciate the Navy and the Air Force doing this. I not necessarily think we really actually need it at the moment, but it is what it is, and hopefully it'll be over quickly, and people will disperse.
Thank you.
Dr. Farley, did you want to weigh in on that, or are you good?
No, that's fine.
Okay. Well, we did have a question emailed in by Chris Durkin, a reporter with Fox 29, who could not join us because of that flyover. And for Dr. Farley, he wanted to know, he says that we are seeing complaints about runners running without masks on the often crowded Philadelphia trails, especially in this nice weather. Did you have any thoughts on that? What is your stance on that?
We've been telling people in general to stay home, but we have been saying it's okay for people to go out for a walk or for a run or a bike ride, just to get exercise to get through this, as long as they stay away from other people. And I haven't been out there. I don't see an awful lot of people being close to each other on those trails. People should keep their distance, but if they're keeping their distance, I think that's okay.
Great, thank you. And this is the last call for questions. If you have anything further, raise your hand now. Let's go finally to Martin Pratt of Philly YBN.
Yes, this is for Dr. Farley. There was a report yesterday, I believe it was either Reuters or Bloomberg, that talked about in China, Wuhan, they actually are finding remnants of the coronavirus in the air in congested areas. So areas like bathrooms, dining halls. And I'm wondering, have you seen that report, one? And then two, is that something we're thinking about? We're requiring business or allowing businesses to reopen. Are we requiring them to do air filtration?
So I did not see the report. It is felt that the majority of the transmission occurs through droplets. So that means that the virus isn't staying around the air for long. It's when droplet goes in and lands on the surface or lands on the ground, that's where the exposure rather than lingering in the air. Right now, we're not, with the exception of essential businesses, we're not encouraging businesses to be open. If we get to that point, we would have a variety of steps in place so people don't stay near each other and they're not spreading droplets with each other. The people keep cleaning the surfaces, but the other steps to really change the air is probably not going to be likely to make much difference.
Okay, thank you.
Thank you, Martin, and thank you, everyone. That concludes today's daily briefing, and we will return tomorrow at 1 p.m.